Welcome back to Clinexa Crash Cart Masterclass. Today, we'll explore drawers 4 and 5. First, oral airways. They help maintain airway patency in unconscious patients with no gag reflex. Next, the nasal airway. It helps maintain airway patency, especially when an oral airway isn't tolerated. Smaller ET tubes from 2.5 to 4.5 millimeters are generally used for neonates, infants, and smaller children. Larger tubes from 5.0 to 8.0 millimeters are commonly used in older children and adults, depending on patient size. The Magill is a supraglottic airway used for emergency airway management when an advanced airway is needed. A Stylet helps shape and stiffen an ET tube, making airway placement easier during intubation. Magill's forceps help grasp or remove objects under direct vision, especially during airway procedures. After intubation, tube ties help secure the ET tube and reduce accidental displacement. Suction catheters remove airway secretions. Choose the size according to the patient and airway. Syringes come in different sizes. Choose the right volume and tip for the procedure or medication. Gauze helps cover wounds and control bleeding, while bandages secure dressings and provide support. Yankauer suction helps clear oral secretions, while tubing connects it to the suction source. Quick quiz. Which device is a supraglottic airway? A, B, or C? The answer is C, Magill. That's drawer 4. Now, let's move on to drawer 5 and see what's inside. First, the torch. It's useful for pupil assessment and quick focused examination during emergencies. Next, the stethoscope. Use it for rapid assessment of heart and breath sounds during emergencies. This cable connects. It connects the monitor to pacing or defibrillation equipment. A pressure bag applies pressure to an IV fluid bag, delivering fluids rapidly when needed. Common crash cart fluids include saline and Ringer's lactate. Choose the fluid according to the patient's clinical needs. Quick quiz. Which item helps deliver IV fluids faster? The answer is A, the pressure bag. Okay, see you next video with more crash cart essentials. Still learn, practice, and improve.